start this video from the beginning again because video is broke down. So we have conditions of the storage. It's temperature from 2 to 8 degrees of Celsius. If we disrupt this temperature, and if we store these monoclonal antibodies of the higher temperature, there will be breakdown. And we have isotonic fluid. I'll show you in the next section why do we need it. So we take the monoclonal antibodies and make one large drop, maybe two, like here, under designation anti-A, and we take monoclonal antibody anti-A and make one large drop under the designation of anti-B. One tiny blood drop here. Next, we take one glass stick and mixed blood with the monoclonal antibodies. We mixed the blood by the different glass sticks, because if we took blood from one monoclonal antibody to the another, we can have reaction of gamma agglutination, and this brought out our definition of the blood type. As you see, we have a reaction of hemagglutination under the designation of anti-B. That means we have third blood type. Sometimes if you add a large drop of blood, you can took the isotonic fluid and add it to this whole. But in this case, obviously we have third blood group, so this is not what we need. Go further. Here we have a more difficult reaction. We have reaction of definition of the blood type by the standard serums, and I give you 10 seconds to think about what does it mean. Which blood type do we have here? So I think all from you understand that we have group type A, or the second blood group, because we have reaction with the first serum and third blood group serum, because they have A, and we didn't have reaction of with the serum of the second group, because serum of the second group didn't have hemagglutinins hemagglutinins alpha. A few words about storage. Monoclonal antibodies, standard serums, standard red blood cells should be stored at a temperature of 4 to 8 Celsius. At temperatures about 25 degrees, agglutination slows down. At temperatures above 40 degrees Celsius, agglutination may not occur. If the temperature is below 20 degrees Celsius, agglutination can occur regardless of antibodies and antigens. Currently, it is necessary to transfuse only single group AB0 system and single rhesus blood. Forget the concept of a universal donor and a universal recipient. I wanna from all of you that you read at home what does it mean universal donor and universal recipient, if you didn't know. But I think after the course of the physiology, most of you must understand what does it mean. We have another test before we transfuse blood. I think this is one of the most important tests of blood typing. Compatibility test on a flat surface at room temperature. We took one drop of a recipient serum plus 1 drop of donor erythrocytes, and wait for assessment for 5 minutes. So we took the plate, we make 1 drop of the recipient serum, add 1 drop of donor erythrocytes or donor blood, and we wait for 5 minutes. We must mix by the glass stick these drops, and slightly tilting the plate must wait for 5 minutes before assessment. And if we have reaction of hemagglutination, we cannot transfuse this blood. Why I think this is the most important compatibility test what we have? Because if we determine that this blood type is first and blood type of our donor also is first, so recipient and the donor have AB0 blood type is 0, first blood group, and all they have rhesus positive result, but we know that we have so much more another blood types, so we can have reaction of hemagglutination in this case with another blood types. You understand? So if we have reaction of hemagglutination, when we provide execute compatibility test on a flat surface at room temperature, we cannot provide blood transfusion. Test for compatibility with the use of 33% polyglucinol. In a test tube, 82 drops of the recipient serum, 1 drop of the donor's red blood cells, and 1 drop of 33% polyglucinol. The test tube is tilted to a horizontal position, slightly shaken, then slowly rotated, though its contents spread over the walls in a thin layer. This spreading of the contents of the test tube along the walls makes the reaction more pronounced. Contact of red blood cells with the patient's serum while rotating the test tube should be continued for at least 3 minutes, after 3 to 5 minutes. Add 2 to 3 ml of saline solution to the test tube and mix the contents by turning the test tube 2 to 3 times without stirring. The result is taken into account by viewing the test tubes to the light with the naked eye or through a magnifying glass. Agglutination of erythrocytes indicates that the blood of donor and recipient are incompatible. The lack of agglutination is an indicator of compatibility of blood of donor and recipient. On the left we have compatibility, on the right incompatibility. We have reaction of precipitation on the bottom of the glass. We see the sedimentation of broken down erythrocytes. And another example, incompatibility on the higher glass and compatibility on the lower glass. And another one. Another one very important test, biological test. A biological sample is performed by a single transfusion of 10 ml of donor blood. Its components at a rate 2-3 ml per minute for 3.5 minutes. After that, the transfusion is stopped and the recipient's condition is monitored for 3 minutes. This post number of respiratory movements, blood pressure, general condition, skin color, and body temperature are measured. This procedure is repeated twice. So, in general, we have provide these procedures for 3 times. And if general condition is worsening, skin color become pale or cyanotic, body temperature is increased, blood pressure is going down, and number of respiratory rate and pulse are higher, So we must stop the blood transfusion and didn't provide it with this type of blood, because we have some reaction on the blood. We must be always have alertness of complication. If there are clinical symptoms during this period, chills, lower back pain, feeling of heat and chest tightness, headache, nausea or vomiting, the doctor conducting the transfusion of donor blood and its components immediately stop the transfusion. Transfusion of donor blood and its components must be stopped. But one thing what I want to say to you, you must check the patient, but you must never talk to the patient's specific signs that if you have chills, if you have lower back pain, if you have feelings of heat and chest tightness, headache, nausea or vomiting, we stop this transfusion. Don't say it to the patient. You must be around the patient and look at the patient, and if something going wrong, patient can say it to you. He can say what he feels. But if you say to the old patient that do you have lower back pain, he said yeah I have lower back pain for the rest of my life. I have lower back pain, oh it is increasing, and he think this is his sign of the disease, and you will be think this is a sign of complication of blood transfusion. So didn't tell the patient specific signs which you expect as a complication of blood transfusion. Okay, we have another one situation when the patient needs blood transfusion but patient is unconscious. Very common situation in the emergency and in the intensive care unit. If we see that for no apparent reason bleeding from the operating wound is increased, if we have reduced blood pressure going down, pulse rate increased, change in the color of urine or the character of urine, and if you see any of the above cases occur, transfusion or donor blood, this component should be stopped. What does it mean, color of urine or its character? Normal color of urine is yellow, and if we see the pink or red, it means that our blood which we transfuse to the patient is broke down and go through the kidney barrier and go to the urine. It's very bad because broken down pieces of the red blood cells is blocked this filter, and we have kidney failure with time. I wanna hear from you, but I can't from this video. How much urine must give adult person for hour? You have 10 seconds to say it. Okay, it is good for those who know this, and bad who didn't know, you must recheck it. Normal urine output is 0.5 milliliters per kilogram per hour for the adult person. So if we have not so much urine after blood transfusion, it means that part of our blood is broken down and lead us to the kidney failure. You must monitoring the indicators for every hour, pulse, blood pressure, volume and character of urine, and body temperature, and write down in the history. And we have many of severe complications of transfusions. First group is post-transfusion reaction of non-hemolytic type. Immune reaction of non-hemolytic type can be febrile reactions or increasing of temperature, allergic reaction such as dermatitis, anaphylactic reactions, and transfusion-related acute lung lesion. Second, reaction of non-hemolytic type, not associated with immune response. Transfusion of infected blood, a reaction associated with violation of transfusion techniques and blood. Acute expansion of the heart, air embolism, thrombosis and embolism, and ventricular arrhythmia, hyperkalemia. Post-transfusion reactions, hemolytic type associated with the transfusion of hemocomponents, are incompatible with the system AB0 Rh factor, hemotransfusion shock, and delayed hemolytic reactions. So thank you for your attention. We will see with you tomorrow.